Hello, this is Anthony and Shipa from EULAR TV, and we are excited to have Professor Dimitrios Boumpas from the University of Athens and the lupus expert here with us. Professor Boumpas, you just gave a comprehensive talk on how to treat lupus. Would you like to tell us the main challenges in treating lupus manifestation and why we have to deal with such a refractory disease despite so many medications we have?
Lupus is, although it's not very common, it's not as common as rheumatoid arthritis, can cause significant morbidity and mortality. And because it's multi-organ, that presents additional challenges. What we have learned over the last few years is that when you use steroids in lupus, you have to take this disease seriously. And you have to do whatever you can to minimize their use by using immunosuppressive therapies or biological therapies. Another thing that we have learned is that now we used to be very complacent with the steroids. We used to keep patients for many years on relatively low doses, but for several years. Now we have therapies that we can wean off the patients. And it's challenging in treatment because it's a very complex pathophysiology. If you do transcriptomic analysis in lupus and you compare it with another systemic disease which can be life-threatening, like systemic vasculitis, approximately 2,000 genes are upregulated in vasculitis and more than 6,000 genes upregulated in lupus. So the whole immune system and a variety of systems are turned on in lupus. That's why it's so challenging to treat it.
Thank you so much. It's an excellent talk. Thank you so much. Congratulations.
Thank you.
I want to take this opportunity to ask you about what do you think about the personalization of the therapy in SLE, especially with the transcriptomic data, proteomics data, and the combination approach. What do you think about that?
That's an excellent question. Yesterday there was a beautiful session talking about personalized medicine in lupus. The good thing is about these omics approaches are they allow you to take an unbiased omics view of the disease without preconceived convictions or notions. Therefore, and we have learned quite a few things about this disease. The group from Spain presented beautiful data, but also the data from the States. And can we use them in daily clinical practice? Not yet. But I would like to remind you that in oncology, it took us more than 15 or 20 years to do that, and I'm sure the time has come that we'll be able to use them in lupus.
Thank you so much.
And Professor Boumpas, before we let you go, a final comment. What do you think we should aim for, low disease activity or remission in lupus?
What we discussed in the HUT session was that first, if you diagnose lupus early and if you intervene aggressively early, it may be easier to put it in remission, and that's what you like to do. The low disease activity, it's acceptable, but what I think, and this could be discussed in the EULAR recommendation for the treatment of lupus, the dose of 7.5 milligrams of prednisone that we were allowing probably were too generous, and probably we have to lower that, even taper completely off, now that we have the biologics.
Thank you very much for your time,
Thank
and we wish you to enjoy the conference.
Thank you.
Thank you very much.
Thank you.
Thanks for joining us.